That is a Beej mantras, that activation of Beej mantra helping lot in a sex center. Sex centers is in a sacral, is called sacral center, as the color is orange color. You have to project orange color, and is a lam, is a Beej mantra, is a vam. Om Ham Yam Ram Vam Lam. These are the Beej mantras. This Beej mantra, how it affect the Beej mantras, we will take one program during that time session, that is practical sessions. We will teach you, and you can do it. Very simple exercise. Very simple exercise. Hardly 5 minutes needed to know the things. Om mantra is for your is called cerebral cortex and center here, what they called as a pituitary, and according to the yogic content, and that is anyway we know is a Agya Chakra. This is a Sahasradal Chakra, Agya Chakra. Beej mantra is Om. Hum is a Beej mantra of your throat chakra. Yam Beej mantra of your heart chakra. Ram Beej mantra of your umbilical chakra. Vam is a Beej mantra of your sacral chakra, that is your sex chakra. And Lam is your Kundalini, that is called Muladhara chakra. These all are chakra is what? This is our psychic centers, or you can say anatomically you can say nerve plexuses, bundle of nerves in the spinal cord, and this is controlled with these chakras. Om Ham Yam Ram Vam Lam. These are the Beej mantras are used. The basic how to remember is a very simple way. Om Hamara Yahi Rakhwala. If you remember this, Om is for Sahasradal Chakra, Agya Chakra. Hamara Hum for throat chakra. Yahi Yam for your heart chakra. Ram for your umbilicus Manipur chakra, and Vam for your Rakhwala Vam La. Rakhwala 3 Beej mantra. Ram Vam Lam. Rakhwala Ra Va Lam. Rakhwala. Just remember this, and this Beej mantra you can use, or during counseling you can ask them do the meditation with these chakras. That will have more effective chakras meditation or Kundalini meditation, or you can name is your own way, whatever you find better to explain your patient. How is effective? This is very much effective. Just try it. Their concentration, their relaxation will increase faster. Even blood pressure you can see pre and post. 10 minutes meditation program. Psychotherapy. अरे क्या कर रहे हैं? आवाज मत करो ना. क्या कर रहे हैं प्लीज? Psychotherapy, psychoanalysis is where what we are doing. Whatever this what I explain you, same things we added in this. And now anatomy, physiology I cover. Here is remember, whenever patient having a problem of infertility, if all the investigation is normal, advise the sonography and find out the position of uterus. Suppose the is retroverted, then antiverted, and then retroverted position of uterus. Okay, antiverted position नहीं अभी मत करो प्लीज मैं अभी पेशेंट मेरे अभी ग्रुप बैठा है, प्लीज अभी आवाज मत करो, मेरा पूरा माइंड ये होता है. Antiverted, you have to keep the pillow below the back and perform intercourse. If it's retroverted, advise a doggy pose, as explained here. This is very, very important. Simple things within a week or within a month. My number of cases, those everything is normal, and got the issue after this simple advice of antiverted position of uterus, pillow, keep the pillow below back and perform, and those are retroverted, then doggy pose. If you know this much, this is the more than here you must understand corpus spongiosum and corpus cavernosa. We are whatever we are injecting P shots or platelet rich plasma in corpora cavernosa, not spongiosum. So there is no problem of damaging ureter and anything like that. Or you can do is under local anesthesia, local application of cream and various creams available now, lignocaine with lidocaine combination, and this cream you can use. There is an I think there are two name. Numbex cream is available. If not available, is available even Amazon. You can buy it. This gives the minimum 35 minutes, 45 minutes. Keep it and the under the cold pack, ice pack, you apply and inject the half cc of platelet rich plasma at 6 sides, 3 sides there, 3 sides, both the lateral side, and it can be, and that is the P shot treatment or platelet rich plasma treatment, PRP treatment. Now I'm not taking your much time, just we go ahead with this much anatomy, physiology, this you understand well. And most of the time you have the problem. I told you, size of the penis has no matter at all, because orgasmic organ of the female is clitoris, and clitoris is outside skin. Only little finger is sufficient to stimulate the clitoris. It can provide the enjoyment to your partner. That's why I mentioned here labia majora is 97% responding, labia minora 97, vestibule 96, clitoris 97%, and vagina's role is only 14%. Means vagina stimulation is not much bigger role, so size of the penile shaft is not important, not at all. Now psychology of sexual response, just I covered this libido. Love map. Love map is a new terminology. Here whatever said, the development of sexual development is child is before the age of 8 years. And these are psychosexual response, what the Freud said, 0 to 1 year oral, pleasuring from eating and vocalizing, 1 to 3 anal, pleasuring from repulsion, 3 to 5 years phallic, pleasuring from touching genitals, oedipal in male and electra in female, latency 6 to 11 years, 12 to 18 years is genital, is heterosexual attraction mostly. If suppose if this growing stages, if something is abstraction or certain thing is not handled properly, it may cause problem of maybe their confusion and of the child, and may have the bisexual or homosexual or gay or anything. So be careful about the developmental stages of your child. This much if you know, that is the basic of counseling, so that you can do the counseling of your patient very well and have very good results to your patient. You can provide, if their myth and misconception removed. Is curvature, a penile curvature is a very common, and nowadays the penile curvature is a certain degree is okay, he can perform. Suppose the penile curvature is too much. One patient is just recently come to me after he has taken collagen supplement from the gym, and he had penile totally like this. Penis was there previously like this. Now he can't perform at all. This is a 1 in 1 crore, 1 crore patient. Only one case you can find out such. And here we advise, he don't want to go for surgical line of treatment and taking risk. We advise them shockwave therapy, minimum 30 to 40 shockwave therapies sessions. Here totally can now perform well. Is 70-80% is improvement in penile curvature. Like this now is like this. So it is a very good treatment. Shockwave therapy you can advise along with this nerve stimulation, other things you can give. And they are tried. Most of the people tried the keloid. A keloid condition we give the injectable, same injectables used in the penile shaft, but there is no use. At Canada they use this injection. They had no result at all. He had got the result with the shockwave therapy. At my center, he was here in Pune for 2 months and is happy. Now, here I will give why I am related with the practical OPD cases, so you can understand what is the aim of this, whatever teaching, counseling, and whatever applied anatomy and physiology. What is the role? What is the position of uterus? What is the role if the retroverted? Then doggy pose advised to have the intercourse. If antiverted, then keep the pillow below back during intercourse, like that. Neural mechanism of sex. Neural mechanism of sex is sex center is in the limbic system near hypothalamus. Just we cover, and the brain receives sensory signals and transmit the messages to the muscles and blood vessels. The sensory pathway, especially from 5 special senses: touch, sight, hearing, smell, and taste. So there is a very important factors. The teeth cleaning is very important. Mouth breathing should be the normal. Otherwise, so irritating, breathe and smell, the patient's mood become disturbed and they can't perform. So every major meal must clean the teeth, must clean the tongue with the tongue cleaner, must gargles, must clean your nostrils, nasal, that is a nasal irrigation treatment in the neti, what they call in yogic therapy. Most of the people used during COVID season, cleaning of upper respiratory tract. And this is the pranayam is helping a lot. These all are cleaning methods, is the detox technique methods. You should apply, or you keep one assistant at your center so that they will go and giving a training to each and every patient. So that is an additional benefit to your patient, and they will be very happy with your medicine. Effect will increase 10 times more. This is the reason where, I will show. Here, sacral, we are stimulating S1 to S3 with the keeping the pad, electric pad, obtains an EMS machine. And here we keep one pad and both we ask the patient to do the stimulate at home. They have to buy the machine and they are doing there at home. After 2 weeks or 3 weeks, they get the increase the normal erection and helping lot to such a patient. Hormones in sex, we are just completed. Here we know that testosterone is the male hormone. If it is reduced, if the desire, the testosterone also control your desire, sex desire. Suppose testosterone is reduced, the sex drive is reduced. Advise the testosterone test elderly patient after 40, and if it is reduced, then give the injection of testosterone around 200 or 250. That ampoule, one ampoule, is a macro. These things dose, and that macrogram dose involved, and that is injected once in deep intramuscular, once in 15 days or once in a month. Generally, we advise once in a 15 days, depending upon testosterone level. If it is a free testosterone, is very important, because total testosterone mostly it comes normal. The free testosterone is reduced, and in such cases, you have to give the testosterone injection twice in a month for 6 injection course. And now stop and advise them diet. Diet contain particularly testosterone increasing time is udad dal, that what Maruti, the God Maruti means Hanuman को जो लड्डू जो खिलाते हैं ना, वो लड्डू बनाते उड़द दाल. You can give cereals name urad dal, and fenugreek seeds, methi dana, you can advise the patient to take it. Hormones, then डाइट हो गया, हॉर्मोन्स हो गया, फिजिकल ट्रीटमेंट हो गया, टेस्टोस्टेरोन इंजेक्शन हो गया खत्म. And now, very important, female sexual problem. Low libido is very common because nobody's go for practically nobody's go for local stimulation. That is a very important. Foreplay is very important thing. Sensate, focused, flow. You have to teach every patient bath together once in a week, or if you can't do at home, change the place like that. This is the better way you can guide to your patient to have the, because we can't say them change the partner, but you can say the change the place at least, so that they can enjoy the better way. Diagnosis of female sexual dysfunctions and dyspelvic examinations and all. Okay. In female, mostly the patient comes when there is a infertility issue, unconjugation, is painful intercourse. They can't do the such type of. You have to find out where any infection, this dyspareunia, then you give the antibiotic along with this fungal infection, then this antifungal treatment. Along with this, if not relieved, advise them local anesthetic and dilators. If not relieved, then advise them vaginismus cases should be treated with dilators. And I'm treating here with pain is more than shockwave therapy also we use sometimes. The pain for the pain management case. It's a unit for use for the physiotherapies are used for the pain management. Hormones is over now, my dear friend. We are going non-conjugation. That is a non-conjugation what I told. Vaginismus or dyspareunia is common in the female partner. The maximum 7 years after marriage they can't have the proper intercourse. Not proper intercourse is the unconjugation. Estrogen is responsible for secondary sex, okay, for female. Okay, now just as a tour I'm taking you. I want to complete the session 1 today. Intracausal injections, drug use, papaverine 20 to 80 mg. Here you have to use 20 mg. One ampoule is 80 mg. You make the 4 syringe by 25 mg. Pentolamine had added there, is bimix, papaverine plus pentolamine, papaverine plus pentolamine with prostaglandin E1. This is a various combination we used. So the fibrosis is a very common after papaverine if it is given continuously more than 3 years. Such cases you must need this such type of combination. But be careful. Penile implant is the last resource after your is a damage, the spinal cord damage and other things, and surgical line of treatment. Or after 70 year age, you can use penile implant if you want. It is a condition. Is a I'm not advisable. I'm not advising the penile implant because most of the time female says it is not. It's just mechanical. It's not real enjoyable because I said you size of the penis don't matter. Your little finger is sufficient to stimulate the female. Preparing wife for sexual stimulation while keeping a genital away from the touch. Okay, various type of this control, ejaculatory control. First page, without step 1, step 2, control. Stop and flow method. You can just explain you simpler way. Retarded or absent ejaculation is less common and has several possible organic causes. However, it may be caused entirely by psychological or emotional factors that are amenable to behavior therapy or psychotherapy. Retrograde ejaculation is due to the bladder neck incompetence after the prostate surgery. It is invariably occurs after transurethral resection of the prostate and may occur in diabetic autonomic neuropathy or para-aortic lymphadenopathy. Delayed ejaculation or failed emission can occur due to the spinal trauma and surgical procedure such as radical prostatectomy and proctocolectomy or para-aortic lymphadenopathy. Delayed ejaculation, or I have seen one case, inhibited ejaculation. The patient was on psychological treatment for this depression treatment, and he not told me he is taking some type of anxiolytic agent, and he said, "Sir, I had a divorce, first divorce because of the erectile dysfunction. Now I want to be." They advised me. Penile Doppler test advice is a severe this blood flow deficiency, insufficient blood flow. That's why, but I don't want to go for penile prosthesis. I came to you. Can you help me? Because I am now bored by watching the TV at the night up to all 2 or 3 o'clock. I get up. I want to marry. What to do? I said we will use various therapeutic modalities. If you are interested, may need 3 to 6 months, maybe 1 year. How much benefit I can't say, but if you want to do this, and he tried and he's so happy. He got the erection. He want to marry. He married his one friend of the school friend, and they had first before marriage trial, and they said they now they get the erection but not ejaculation. In such cases, we find again the history, and we stop all the medicines, whatever they taking, whatever he's taking for the depression and all, and he's totally okay within a week. So sometimes you have to find out the antipsychotic drugs and other things should be stopped during the course if you can, under the guidance of psychiatrist, no doubt. These are the various type cases we discussed. Whatever the cases I had treated in my these 30 years program, this is in sexual medicine treatment program. That syndrome is very common. That is nothing but the syndrome is most of the time patient comes, the that is passing, and that is something is very precious fluid, and my energy is lost. That is due to the psychological. Say them, whatever you eat, whatever you drink, that you pass out every day. The same thing that is prepared in the body. Whatever you eat by the proteins, take more proteins, your energy level will be normal. Don't worry about that. It's a normal physiological phenomenon. Now, nothing but it. That syndrome is nothing but the myth. Okay, no doubt.